Hello YouTube, this is Naturally Speaking. Today I come to you just to not have, I don't have a haul or nothing to present, but one of the topics that I really want to talk about today is natural hair and diabetes. I know some people may not think it's a big deal. You have diabetes, you just need to change what you're eating, but I think as for the hair community, I think we should kind of look at it a little bit more. At least I feel like it does. As you can, as I told you before, I am a diabetic, and been diabetic probably about a good 2 years. And so some of the things that that I did notice is my hair, of course, becoming a little bit more drier. And what brought my attention to it even more is recently had a meetups with the Nati Naturalista event, and one of the presenters was talking about, you know, how to moisture retention, how to retain moisture, keep it in your hair, and some of the issues for dryness is some of the medications. And lo and behold, it never dawned on me that medication, I knew certain ones can make your skin dry and give you some kind of reaction or something, but I never really thought about, you know, medications such as, you know, diabetes medication. One of the things that like I said, I did notice was my hair being extremely dry. And one of the things that the hairstylist talked about was, you know, letting her people that she does their hair, let them ask them about, you know, what medications they take to find out, you know, how to keep the moisture in. And it was one of them was the medications. You know, it can range from, of course, high blood pressure medication, kidney medication, you know, respiratory medication, but any type of medication, and there is some kind of side effects to them, most of them. And one of the ones that, you know, that I do take, you know, one of the things that it did was, you know, of course, I would think that I did notice from me is my hair being really dry. And what she touched on was, you know, basically you have to take in more water, you know, drink more water, try to keep your hair moist as much as possible. Kind of, you know, certain things you put in your hair may not work. And mainly because, you know, when you put in medication in your body, it goes all over. And me not thinking about that was, you know, oh, it's not going to, you know, it's not going to be my hair, but, and in fact it does. So, one of the things that I recently did try was the, you know, apple cider rinse, just to see how that will work on my hair since it's so dry, just to try to do the, you know, try to bring in more moisture. And my hair, which was called the, you know, the maximum hydration method. Even though it's not for everybody, I wasn't trying to obtain a wash and go, because I know for my hair type, I have 4C hair, so it may not, you know, really work and on my hair as well as it would with someone with 4A hair. So, but for me, having diabetes and knowing that my medication that I take, sometimes, you know, it does, and you know, for me, you know, can have a drying effect. And what I did notice was my hair. My hair, you know, has become really dry, so I had to basically recently do some extra things to my hair, try to keep the moisture in my hair. And you know, medications itself has some effects to them. It may not happen to everybody. I'm not for sure if you know this is a subject that a lot of people want to talk about, but you know, in the African American community, we do have a higher risk of getting diabetes. And that's one of the things that, you know, being tested early have your doctor, check your A1C, see where, how high it is. If it's high, they may prescribe you medication. If it's, pretty low, then you're doing really good. Also, when you take the glucose test to see if you do have diabetes, that's very important. You may want to talk to your doctor about that. You know, get some of the side effects, eyesight, that's one of the things that, making sure I go to the eye doctor every year because, any day, wake up, eyesight may not be there. So, basically that's what I wanted to talk about, just to let all my, naturalistas out there to know, about, medication and, diabetes and basically being aware of it. You may take medication and never think that, oh, it may be affecting my hair, but in fact, it could be, and basically what you do is, drink more water, try to get the medication out. It does its job, and it's time to get it out of your system. So that's one of the things that, that I try to do is drink more water. In the meantime, I am on 2 medications. I'm type 2, so I'm not insulin dependent. But I do have a medication that controls how my blood sugar react in my body, and it basically just kind of slow down the insulin that's distributed throughout my body, especially after I eat. And so far, I have kept my A1C down low. I'm happy about that. And I have, taken on, more exercising. I basically start out slow. I've changed my eating habits. And in the meantime, I've lost close to 20 pounds. And that was in probably about 5 months. So I feel like I did pretty good. I mean, I wasn't expecting to lose that much weight. I really wasn't trying to lose the weight, but part of the medication, that's what it does. So, but I just wanted to share that tad bit with you today. And as you notice, I have on my pink for breast cancer month. Go out and get your mammograms, and just be aware of it. One of the leading causes of deaths in the African American community is the or just in women in general, is the breast cancer. So be aware of that. Get your mammograms. And like I said before, as far as diabetes go, it's not a little thing. It is, in fact, it is a big thing. So I just would like for everyone to be aware of that, especially our natural hair ladies and men out there that is trying to achieve more moisture in their hair. So, but that's all for right now. I'd like to give a shout out to our Natty Naturalistas out there, and also to curl friends, and also to I'm Loving My Natural Hair group, and just basically, just be aware of diabetes and natural hair, and drink more water, keep hydrated. And I think that's all for now. Thanks for watching. Any comments, that'd be fine. And I have information below. And check me out on Instagram at Naturally to Speak. Talk to you later. Bye.